right? And they are actually professionals in what they do. And we are very lucky to have both of them on this call today, right? So I will introduce Sarah first. We'll start off with Sarah. Sean had mentioned that he might be a little late. So, Sarah, we got to know her recently, and I had a chance to meet her in Bangalore as well. Yeah, she is a pediatric speech therapist working with children on the autism spectrum. Right, she works professionally with children and families deal and navigate through life and their communication difficulties. That is a very very important topic, and she's extremely passionate about it. And she has told me that I'm so passionate about it that I might continue talking. Please stop me. But we are looking forward to listening to you, Sarah. This is something I believe every single person should know. Sometimes we don't know how to behave or how to handle such people, right? And we are very lucky to have you here who can guide us on how to go about this. So looking forward to a great, interesting session. Let's have Q&A at the end of this. So I'll hand it over to Sarah with a round of applause.
Thank you. Thank you so much, Joe. Thank you so much, Priya. I mean, it's a privilege and an honor, I think, to be able to do this, especially on a platform like this. So I really respect and applaud you guys for actually being open and everybody wanting to actually listen to this. So just to give you all just a very, very brief idea, like I told Joe yesterday itself, please stop me because I can go on and on about this, and I really don't want to steal a lot of time, and actually want it to be something that you all can understand also. So just to give you all a very, very brief idea. So I am a speech therapist, and my job is working with both children and adults, or anybody basically at any age who have difficulties in terms of communicating. So when we say communication, and we deal with a lot of other things, but mainly we focus on communicating. When we look at communication, we take it for granted. Okay, that's something that, because it's something that we all do very easily. Nobody thinks about how you talk. If you want to talk, you just talk. Nobody really knows the intricate things that need to happen within your body for you to be able to do that. And my job and my role is to work with people who have these difficulties and find ways and modalities to make it easier for them, either to be able to talk or find another alternative way for them to communicate. So very simply put, if I just have to explain what communication is, it's just a back and forth. Like, I'm talking to you all understand what I'm trying to say. Your brains are able to process the words that are coming out of my mouth. My brain is telling my mouth exactly how to move, where, which muscle needs to move where, how I need to talk. So when there is a mismatch in this whole process, is when you have somebody who has a communication difficulty. Okay, very simply put. Now, this can be through multiple reasons. Now, again, my main objective is like to get you guys to understand this, is so that if you see somebody who's struggling, that, okay, this is where they need to go. So right now I am mainly focused on pediatrics, but I do have an expertise of working with both adults and children across different age groups. So communication, we look at it, we see, okay, it's just maybe verbal speech, but it's not just about the motor movement and me just talking and saying stuff, but it's about understanding, okay, these are the words that are coming out of my mouth, or these are the actions that I'm showing, this is what I'm trying to say. So when you look at children, you can have a wide variety of reasons why this happens. Again, it can be a genetic disorder. There are a lot of different disorders that do come in. It can be something that is passed on genetically from different generations. Sometimes it gets hidden in one generation and it shows up in the next. You can have children who have everything okay, but there will be something that happens during the pregnancy and you will see that, okay, things are not okay. Now, you can have children who've got high fevers, which go into having seizures. You can have children who have, different complications all throughout the pregnancy period or right after the child is born, which do lead to these difficulties. Now, how do you know? Like, if I'm talking about adults, I think many times what we would see is things like people who have a stroke, or people who have, I know Sean is also a physiotherapist here, so he will definitely be adding in. So, we've got people who have accidents, who meet and, who lose their ability to communicate, and lose their ability to speak, lose their ability to eat. See, these are when you understand the way that we do it, you'll realize that it's all the things that we take for granted on an everyday basis. Talking, eating, things like that, which we really don't have to think about, which muscles need to move, what needs to be done, but it takes so much of effort to do that. So when it comes into these things, now we work with people who have communication difficulties in terms of their voice, in terms of, you might have seen people who stutter, or I'm sure you guys would have seen movies which show people who have stuttering. You've shown people who have voice problems, who have different kinds of syndromes. You would have noticed, I'm sure somewhere along your journey, you would have seen at least one or two people. You will see people who have hearing loss. You see children who are born with genetic hearing loss, and that doesn't allow them to speak. Now, a few red flags, or what I would say, a few pointers that could always make you all understand better, is that there are, especially in children, okay, if I'm looking only at children, I would say is we've got something called developmental milestones that we look at. Okay, so a lot of parents are not aware of this. Sometimes you understand it better if you have an older child, and then a second one comes, oh, my first one spoke at this age, so then this is. But many times, and we've got a lot of stigma, especially in the Indian community, that, oh, it's a boy, he will talk late. Or, we have a lot of these, we hear this on a constant basis. We have a lot of taboo that comes in. Oh no, it's not, he's okay, he's just 4 years old and he's not, he's not talking, he will talk over time, and things like that. That does happen. But there are certain milestones which happen at particular ages, which parents, in and about, I'm not saying that, okay, this on this particular day of the child's age they will start talking, but on an average a child will start making certain, and we can start seeing that if it's a hearing loss, within the first month we diagnose, within 3 months we confirm it, within 6 months a child has a hearing aid on and made sure that they are taken care of. If it's a child who doesn't talk, so even just the sounds that the child starts making at 3 months is an indicator for us, okay, where is this going? At 6 months, within 1 year, we want to make, we always try to see that, okay, child at least has one meaningful word that the child starts to say in and around. Again, I'm not saying, but if you come to me at 1 year, 2 months, I might still say, okay, let's wait a little longer. But if you come at 3 years and say your child is still not talking, that's a big red flag for me. So we kind of work on this. So these are certain milestones that you will see, again, that if there is a delay, if you see a child not sitting up at the right time, or crawling at the right time, or not doing things that you would normally see other children do very easily, you will see these children have difficulties. These are all signs and flags for us to understand, okay, something is going wrong somewhere. Another huge, now my main area right now that I'm dealing with is children on autism, on the autism spectrum. I'm sure you all would have at some point seen either movies that show them as kids who have really great skills, or if you watch series like The Good Doctor, you will see them doing like really extremely great things. Yes, that is a different part of a spectrum, but autism spectrum is generally children who have issues. I mean, generally individuals who have issues in terms of their social communication. They just don't know how to connect and talk. Now, we take it for granted that all of you sitting here now, you're all listening to me. Okay, we don't immediately just stand in and we just talk. We know there is a decorum. We know there's a way that certain things go. These kids find it really hard because of so many issues that are going on inside of their body that they're not able to do so. And because they don't communicate, people think that they're just putting out a tantrum, or people just think, okay, they're just throwing themselves. And you would have noticed, if you go into a mall or a market, you might see one child screaming and crying on the floor. I'm not saying all kids do that. I mean, even normal children do that, but certain red flags where you see a child completely disconnected, not able to connect with another child, or not able to connect with the parents, and not wanting to do things a normal way. You will see certain repetitive behaviors that you'll see them flapping, you'll see them, do things like they have a lot of stims that we call, they'll be running around, jumping around, and it looks, some kids, it might look very subtle. Some children, again, that's why we call it a spectrum, because it's a wide variety. No one child is alike. Okay, so these are certain, again, there's a lot of details, I don't want to go into a lot of that, but certain red flags here and there that you can notice, that you can see in people, that you can see in individuals, and know that, hey, something is going wrong. Now, where do we come in is that because we understand this, so parents don't know, or people don't know how to work with these individuals. So they think, okay, fine, let's just kind of cut off the behavior. The child is screaming and crying, let's just give in to whatever they want, or let's just, that people try to compensate in different ways without really understanding the underlying issue. So that's where we kind of really have to understand that every child is different, every child is unique. And it comes with a lot of, if there are many parents here, if you've got normal kids, I'm telling you, it's a blessing. Day in, day out, I deal with parents, I deal with children who struggle, who suffer so much, and we don't realize. We take it. So, when you see your child going to school and not scoring marks, trust me, it's a blessing to be able to see that, and not be, and to have a child who can do things on their own, and be able to not be independent. These kids need help. These kids, and our hope and other thing is to make it a more inclusive society where people don't look down on them. You would have seen children who've got intellectual disability, you've got children who've got syndromic faces, they look different, but hey, if we expect them to come up to our level and understand and work at our level, but isn't it so much more easier for us to go down to their level and understand their difficulties? So that's the whole, that's the whole thing. So when you see these kind of things and know that, okay, these are the right people that I need to refer them to, these are the right people that I need to get them connected with, it goes a long way. It can be as small as just, in their speech, it's not clear. It can be as small as they're not able to hear properly. And you notice such signs, like if I'm talking about a child with a hearing loss, it's at 1 month, if the child does not respond and look where the sound is coming from, or doesn't move his head, that's a big indicator for me, hey, something's not okay. At 3 months, if the child has not started babbling, that's, again, these are a lot of red flags that we will see along the way, which are details. But if you notice such things, you always, out of concern for whoever it is, please do tell them. Don't go in with the flow of, especially our older generation. We constantly hear this where they say, or they'll go put some medicine and tell the child will start talking, or, they'll go give some syrup and they'll say your child will start talking. They'll go to these doctors, they'll go to people in the villages, and they do such things, which is still very, very prevalent in India. We think we are as developed, but there is a whole part of the country that is not. And we see this in different forms. So that's a huge thing that we deal with on a very, very regular basis. So some things that you can look out for, but I just wanted to bring this out into the light for you all to understand in terms of how to notice this, and also to know that it doesn't come, it's not easy. Like I said, when you have a special needs child, or when you have a person who is having some sort of physical, emotional, or any sort of difficulty, it does take a toll on not just that person, but it takes a toll on the family. It takes a toll on every person who deals with this individual. And it's not a very easy road to actually take on. But at the same time, there are a lot of ways that we try to navigate and work with. I always tell my mothers that I deal with, because mothers are usually the ones who bear the brunt of the social stigma. They have to bear things like their in-laws calling them and telling that you're the reason the child is like this, and so many things which happens, and try to get them to be emotionally sane, for them to be able to deal with their child and to give the child the best of their ability. So it's a very, very tricky, but it is a beautiful journey. I think it's not something that it's not something to be looked differently upon, and it's something that has a lot. I just, for me, it's like, okay, if you guys get one point of it somewhere, I'm more than happy to know that, okay, there are a few people who are willing to know this and learn more about it. So that's in a nutshell what I do right now at this thing. I'm sticking to my time, Joe. I'm not going to take more, but that's really a big nutshell. But if anybody is interested, I would love to answer questions and kind of take this forward and get connected with people. So yeah.
Awesome, Sarah. Awesome. I'll open it for questions. Anyone having any questions? You can use the chat or you can unmute and ask questions. Yeah, Krishna,
Hi,
go ahead.
Sarah. Amazing talk. It was very informative. And yeah, it really kind of opened my eyes. Earlier, we used to see that, when I was in school, um, they used to have a separate wing altogether for these children. We call them in UAE, we call them people of determination. So right now, I find that in my son's class, there is one child like this. And the kids all come together, they support him. One carries the bag, one helps pack his bag, one helps feed him. Now I see nowadays the kids are more, emotionally aware. And, I don't know. I mean, initially I felt, it's a very shameful thing for me. And my wife corrected me, you shouldn't be that way. But initially there is always this stigma. But then my son showed me the way, and I'm very happy that the kids these days are much more open and, more loving and caring that way. So yeah, just wanted to share that.
Wow, that's beautiful. Yeah.
Go ahead, Krishna. You had a question.
Thank you so much. A lot of information you gave. Wonderful. I just have one query. My sister's son is suffering from this autism spectrum. So she has shown him to so many doctors and pediatrician also, and she got done that speech therapy, occupational therapy also. Means whatever is suggested, she has gone through it. But I just want, in a nutshell, how should the parents go about it? I mean, what all they can do at home, because she is a working mother and cannot, cannot spare so much of time. Means I mean, leave and all. No? There are restrictions in government job. So
Yeah.
how should she go about it?
So again, I mean, each child is different. So I would definitely love to, get a much more detailed thing. Maybe afterwards you can definitely connect to kind of understand that better. But I always tell this to all my parents. Parents, you guys are the best therapists that are there for the children. I mean, we see the kids we see them for 45 minutes once a week or twice a week. But if you all learn exactly what needs to be done, and understand that it's not about I spend hours, again, it's not the quantity, it's the quality of what you do. Now, like I'm expecting my child, like I'll just use speech as an example. Like you're expecting your child to talk. Now, if this child is not aware of where his mouth is or where the parts of the mouth are, and has sensory issues, has motor issues, has feeding issues, has so many see, again, with autism, let me tell you all, it's a very invisible disability. The child looks normal. Everything looks normal on the outside. So you expect them to be normal like other kids. So when it's so invisible, people just don't really understand that there's so many things that's going on. A simple fact of me I'll just give you a very, on spot example right now is if I have to say the word pan, my brain needs to tell my mouth, okay, jaw open this much, my lips need to move at this angle, this degree, my tongue needs to go up and touch my palate. There's so many intricate things that happen together at the same time simultaneously, which we are not aware of. Now, if a child has a certain difficulty in this, and I'm expecting this child to talk to me and tell me a story, it's pointless. So you need to understand the root of everything. Again, a lot of, and I'm very ashamed to say this when I say that there's a lot of quacks in our field. There's a lot of people who are doing things without understanding the science behind it or understanding the roots. Again, like, how all of us, we see it day in, day out. Like there's a lot of unnecessary things that's going on like just dealing surface level without dealing at the root issues. So without dealing at that, whatever you try to do on top, it's just going to be a temporary relief. Now, I'm not saying that these children, you can make them normal. They are special children, but you can definitely make their life better. So that's in a nutshell that I would say. So it's just mainly about quality. You don't have to take in a lot of leave, but the time that you spend with your child, you need to be able to invest the right things, do it in the right way, and do it. So if you can, connect with me after, I would love to, walk with you guys and try to, understand that better. So we can do that.
Sure, sure. And one small query, does
Yeah.
the overuse of gadgets or these smartphones could be a risk factor for that?
Absolutely. So I say that 100%. I mean, not just for autism, but any sort of delay. See, when we are communicating, like let's just take Krishna, you and me right now. You talk, I listen. I talk, you listen. There's a back and forth that happens when a child is looking at a screen. And this was my thesis, so I say it very confidently. I can say that a continuous exposure to any child, I've seen children as small as 1 month being exposed to screens. Okay, it affects their brain, it affects their development, it affects their nerve pathways. That just messes up so many things. And they're just looking at a screen, and you're looking at, and our eyes are adjusted to seeing things moving so fast. If you see how a TV or anything moves, you've got continuous light and auditory, visual, and everything is happening together. Their brains just are literally like sponges at that point. They're just taking everything in, that they don't even realize that that it is affecting them. And so what happens is it hampers communication, it hampers their need. Kids have feeding parents. The easiest way is keep the child in front of the screen, feed them, everything goes down. But what is actually happening is child is not understanding what is hunger, when to stop, what are they eating, what is taste. None of these things are being made, they are understanding. So screens do play, I can say, any child who's exposed, at least for the first 6 years of life, any child who's exposed more than 20 minutes to 30 minutes of screen. And again, the quality, if you're just keeping the child to keep them occupied so you can do work, I tell my parents, watch screen, but watch it with your child. Interact with them and talk to what they're seeing. So that makes it more interactive than just, okay, it's an easy way out. Like, we all want everything instant and quick. So if I keep, the child is going to keep quiet. But how much it affects, it's a huge, drastic impact that does. And I've seen any child who's been exposed to more than 45 minutes of in a day, if they're exposed, you will see every skill of theirs get affected. You will see that. So I tell parents, like, big no to screen time. Again, how much you do, all of that matters, but definitely it's a big risk factor.
Thank you so much. Thank you.
Yeah.
Krishna, I'll pass on Sarah's number to you. You can contact her later.
Sure, Joe. Thank you.
Anyone else? Any questions?
Hi, Sarah.
Hello.
Yeah, hi. Yeah, Sarah, I wanted to know, and in fact, Krishna asked something which I had a query on. So this is basically, I want to talk about visual autism.
Yeah.
Okay, which was, you would call the spectrum of children who are very normal. Okay, and unfortunately, due to COVID, okay, I'm talking about the set of children who were born in the upper KG and the lower KG children who were forced to be on the schooling, online schooling, so-called, and we see a lot of homeschoolings also. In fact, if you see where they are studying through the medium of online, So, and I see some of these children in my daughter's class, I have seen, they all are facing, like if we have a class of 40, around my daughter right now is in 4th standard. Okay, so around half the session of the children, they all are facing problem with reading. They all are facing a problem with speaking confidently or problem. And the term that had come up was virtual autism. Okay, no, visual autism. Sorry, visual autism. Now, my question is this, that, okay, now this was not, they were born with such a thing. It was due to the circumstances this has become.
Yeah.
Is it a reversible thing? Like how you said, even if you give a quality time, I know teachers where, they said they need a shadow teacher for such, so it was very thing that does all the 30 students will need a shadow teacher or is it reversible?
So again, it's a huge myth that comes along, that there is something called virtual autism. It's called virtual autism. Now, just to put a little bit of light in it, that's where a lot of doctors use this term. to say. And I mean, no disrespect if there are any doctors here, no disrespect to anybody, but we deal with these children one-on-one much more than doctors spend 5 to 10 minutes or 15-20 minutes in their consultation room and just take a history. So we understand this a lot more better. So I really respect doctors who tell, okay, go to your therapist, they know what to do, but that's a very rare case in India. But virtual autism is not something that is, see, autism is where there's a whole system in terms of their brain where the wiring goes, it's mismatched. Okay, so for example, like very simple example that I give is when you're looking at my face, all of your senses are so integrated that you know where my eyes are, this is my ears, this is my nose. You know exactly all of that because your brain is able to process all of that. These children have issues in processing any of this. Okay, it can be very mild, it can be very severe. Now, that is what autism is. People have put this tag of saying that, okay, excessive screen time causes autism. It's not that excessive screen time causes autism, it just like increases it. Okay, so there's that virtual autism is not really something, it's not there. But these children now, like you're saying, who were having a normal development and everything was fine and due to circumstances did that, you might, out of 30, I'm very sure that there will be at least 20% of that who were having difficulties before, which was going unnoticed. One, okay, and it's not that every child just, okay, one fine day, okay, they're having these difficulties. Because if it is only something to do with the virtual screen, even with the screen, I say that children can have a speech delay without having autism. Okay, and that, yes, I can work on and improve their speech and all of that. And, you know, if I reduce the screen, I improve their interactions, I give them more peer, like play with other children, you will see these kids picking up. But that's not the case with autism. You will see improvements, but it's, you know, it's not going to. So I would say out of 30, I'm very sure that a whole bunch of them would have had certain traits or would have had certain difficulties, like reading difficulties, writing difficulties. Is a whole spectrum of learning disability, which we deal with on another basis. So these kids have that, which is not autism. It's another issue altogether. So they have, if you guys have seen Tare Zameen Par, that's a very tiny part of what we deal with. But there are kids who have those difficulties which go unnoticed because of various factors throughout. See, at LKG, UKG, you're not really worried about how the child writes. Or at first grade, you're not really. It's only when, and certain kids, they only when the pressure starts building up, you'll start seeing these things come out. So that's what I would say. So it's not, everything doesn't come under the autism spectrum. There are, again, different disorders that happen. So most, like if you said reading, writing difficulties will come under learning disabilities, kids who have difficulties only with math. But you'll see that their IQ is great, their social interaction is great. All of those things won't have an effect. So when it's that, you know, again, that we have different things that we differentiate it with. But if it is autism, you'll see a whole lot of, like, they don't know how to socially interact at all. You know, and things like that, which get affected. I hope I kind of answered that question.
Yes, Sada, thank you.
Yeah.
I think it's a very, very important topic, and a lot of people have a lot of questions. I think one more question has come from Megha. Could you please suggest any basic techniques to improve communication skills for people who are aging or who have any underlying medical condition?
Okay, basic techniques. Okay, so basically communication, we look at it, I'm just giving it in a very brief way, is we're looking at communication, we're looking at just speech. Now, if it is somebody who is aging, if it's somebody who's losing speech, especially people who've had strokes and things like that, where their speech gets affected, again, communication is not just a verbal thing. It's not just speech is like, now, even if we take us, for example, we talk only 30% of the time. Rest all of our communication happens virtually. How many of you are sitting and calling each other and telling, like, even if it's within your family, you might just send your husband or wife the grocery list and say, hey, please buy this and come. We all do it. You know, different technology is there. We are in an era where we have technology, where we have the access to communicate non-verbally. If we are in the same room, or, you know, in the same house, but in a different room, I might not scream. I might just show you a gesture of, hey, come here, you know, and you would understand that. So there's a lot of non-verbal communication that we teach. So for people who have difficulties in terms of verbal speech, we go into something called alternative communication systems, like finding other systems that work for them. Now, if it's a person who's got Parkinson's, I will not give them a device and tell them, okay, type out and tell me what to do. I will see what works for them better. So that again, a professional will decide based on the difficulties, the abilities that the person have, and we will kind of work on that. But we work on something called alternative systems, communication systems for people who have other conditions. So yeah.
Awesome, Sarah. I think a lot of people will have more questions. We'll get Sarah back for one of our next sessions, maybe not the next one, few sessions after this. Thanks a lot, Sarah. A lot of learning for a lot of people.
Yes.
Right. And I like what Evan said, slowly getting these children into mainstream helps other children a lot, but I'm not sure about the children, those children. I'm not sure how they find it. I think Sarah would be a better person to tell that. Because I see that, right? Even someone who's not exactly normal, like what we perceive, even Jessica, my child also can't understand who that person is, what they do. It's very difficult to explain to them also. So I understand what Emin was coming from. Anyway, thanks a lot, Sarah. It was a wonderful, wonderful session. Thanks a lot. A round of applause to Sarah.
Thank you.
Awesome. So we'll move on to the next speaker. Today, we are blessed to have such great speakers for us. Right, we have Sean with us, and Sean is a physiotherapist. And again, I believe most of us have kids, and that is why we were so close to Sarah's topic. And also, we know kids who are like that. And similarly, what Sean is going to cover is something that most people, especially the IT industry, requires. Right, and I believe I personally would want to listen to him and understand and implement what Sean is going to tell. So with a round of applause, let's invite Sean. Oh dear. You're on mute. Mute.
Yeah, good evening all. So thank you for the amazing introduction. And thank you for Sarah. Thank you for the amazing session. I really enjoyed it. I get useful information. So let me introduce myself. Sean Anthony. I am a consultant physiotherapist and a co-founder of Heal Life Wellness Center in Kerala. And thank you, Mr. Joe and Hashim, for giving me an opportunity to share some concept about the movement control. Actually, why I select this topic is there are a lot of belief, or there are a lot of belief systems are going there. Like if anyone is having a back pain or a neck pain, someone is going for a physiotherapist or someone is going to consult a doctor. So simply they will prescribe some medicines. Am I right? First time they will prescribe some medicines. And nowadays it's changed somewhat, but still it's going. So after 2 weeks, again, the same thing, the same pain will comes. At that time, they will say, with respect to doctor, what I'm saying is, so after 2 weeks to consult a physiotherapist, better you consult a physiotherapist, then you can do some exercise. Then sorry to say that, I am also a physiotherapist, but some physios are saying that, okay, they are living with some fantasy treatments like taping, cupping, a lot of fantasy treatments. So no one is addressing the root cause of the pain or a root cause of the injury. So that's a make it sense, no? So I hope after this discussion, everyone will more aware about our own movement and more concerned about our own movement. So that's my motive for this class, actually. So directly, let's move to slide. I prepared the PPT, so let's move to slide. So my topic is like role of a movement health checkup in working professional. So on the first slide, you can see, in this slide, you can see early human life involved more physical activities. Various diet, exposure to natural elements contribute to reboost health. But in modern life, everything is changed. In early life, they are using stairs for climbing. Now it's replaced with lift and escalators. For traveling, we'll use bike, car, or walk, or car. Correct, no? So walking is very less. The movement is very less. So that's the main problem what we are facing. So due to the gift of new technologies, but we are lacking something also. We are lacking the movement. So that's we have to work on it. Okay. So let's move to next slide. There are certain conditions. There are certain conditions that is associated with prolonged sitting or like a working professionals. There are, in this decade of life, most of the people spend excessive amount of time on their phone, computers, and other devices. It will increases the duration of sitting. Initially, after a range of negative health effects like neck stiffness, text neck syndrome, neck pain, back pain, knee pain, and after sometimes it will lead to some fancy names like cervical spondylosis, lumbar spondylosis, OA knee, disc prolapse, like that. Some fear names will come after collecting the MRI report. Everyone is scared because due to after the MRI report, someone is saying that don't move more, don't move forward, don't move backward. If you are moving forward, then your disc will prolapse. So this is the situation what we are facing. So I have to break this concept. So that's only my goal. But very sorry to say is that I am also physiotherapist, but most of the physios are doing the old thing, the conventional thing. Okay. Next, let's move to next slide. In that, we'll discuss about the concepts of pain, how pain will come. Okay, so with the definition, it's a unpleasant sensory or emotional experience that is associated with actual or potential tissue damage. It's a pain definition. There are a lot of factors that leading to our movement pattern. So one is articular system, second one is myofascial system, third one is neural system, and fourth one is psychosocial influences. So in that, first one is we discuss about the articular system. In this, injuries can result from number of causes. It includes any forceful impact to the joint as a result of any sports injuries, or like a myofascial. That means like pressure or sensitive point on the muscle cause also maybe due to some muscular imbalance, or the low level muscle contraction, muscle contractures, or due to direct trauma or muscle overload. Then third thing is due to some neural involvement. So that means if you are not treating the muscular imbalance properly, so that leads to nerve compression. You heard the name, interesting name, that sciatica, lumbar radiculopathy. In MRI reports, it shows very interesting names. Am I correct? No? Then
yes.
Last one is about the psychosocial. So this, anything is involved that will affect our movement. And any one of these component will involve means it will affect our movement. So psychosocial. So actually, I have seen a lot of patients who come with a neck pain, chronic neck pain for more than 10 years. So while consulting, I got some ideas about, where you have pain. So they're confusing. I have back pain since more than 10 years. I cannot able to move. I cannot able to forward. I cannot able to lift the weight, like that. But the main thing after my assessment, sometimes I got that it's purely psychological. So in my knowledge, there is no treatment for physiotherapy for this type of pain. So better to consult a psychiatrist or better to consult a psychologist. So that's why I took one psychologist for my clinic also, actually. Okay, so it's about the common factors that leading to the movement. So next, let's move to next slide about the health checkup and movement checkup. I think this generation nowadays, here also we are hearing a lot of getting new classes and awareness, but everyone is aware about and everyone is concerned about health. That truly I agreed, but everyone is having like blood tests, sugar checkup, blood pressure checkup, cholesterol, everything. But no one is aware about the movement checkup, how our movement will check. So that's our next thing. So we have to assess the movement too. Diagnosing the disease through movement checkup in a physiotherapy is very, very important. When a pain is occurs, movement checkup is a treatment method to find out the root cause of the pain. Most patients come with back pain or neck pain. They only want symptomatic relief. They don't want the why I have back pain. They don't want exact answer. I have to cure back pain. That is enough. I need some pain relief. That is enough. No one is aware about what about my movement. No one is aware about the movement. So that's the main thing that we are facing. So we have to break the concept. We have to break the belief, actually. So, in this movement checkup, what we are focusing is, I will tell you with one example. If anyone is having a neck pain, okay, so I will test like, I will do some neck movement or normal movement, like you do the neck flexion, extension. But if anyone is moving the neck flexion, someone is compensating with upper thoracic spine. So that means if you're flexing the neck, you are moving with your upper back. So that's a compensatory movement. That's a compensatory movement. So we have to rule out whether it is isolated movement or compensatory movement. So that's a very, very important thing. Okay, I will share one example. I will add one more example. For example, if anyone is having, ask them to do shoulder flexion. So this is normal shoulder flexion. So instead of this shoulder flexion, if you are doing like this movement, it's a compensatory movement. It's a compensatory movement. We are using with the back muscles. It's a compensatory movement. So in that, what we are using, we are prescribing medicines. There is no use. If you are doing some physiotherapy, fantasy physiotherapy treatments, there is no use. Whatever fantasy treatments, there is no use. We have to fix the shoulder. We have to fix the scapula. We have to fix the neck. Without finding the root cause, we are treating the symptoms. There is no use. So that's about that slide. So next, so this is the picture. What I have to choose, why I choose this picture is for easy understanding. So in this picture, you can see without focusing the root cause of injury and with focusing the root cause of injury. So in this, on the first picture, what we're seeing is at the age of 20, someone is having a knee pain, and if he is treating with medicines and conservative physio or any other treatment, then again there will be a chance of knee pain again after 30 years. Maybe it's around 30 years or 40 years. So again, they will do sometimes do some injections or some physios, again treatments, etc. Then, but till now we are not identifying the root cause. So at the time of age 60, what the doctor is saying after the X-ray report, the X-ray shows joint space is less, disc degeneration is more. So there is no other option for surgery is the only option. There is no other option. Surgery is the last option. So anyway, we'll go for surgery. So on the next picture, what we choose, why we choose that picture is, if you understand and if you ruled out the root cause first, okay, for at the age of 20, if you are finding out what all movement issues is happening there, then with that root cause, if you do the treatment, then there is no chance, there is less chance of recurrence of pain or the recurrence of the injury. Okay, so this is the concept I have to convey, and this is just a introductory part. It's a verse syllabus actually. Yeah, this is about the my topic actually.
Awesome, Sean. I totally support what Sean said, especially the last part is something I really believe in, right? We all try to fix problems with some short-term solutions instead of finding the root cause and fixing it. Even as we all know, right, in our weight loss program, also that is what we focus on, right? Finding the root cause and fixing it. And I totally agree
Yeah.
with Sean.
Yeah, actually, the thing is, no. For example, if anyone is going for a weight loss challenge, someone is eagerly to say that I have to, within 2 months, I have to lose weight. I have to lose weight within 2 months with around 20 kg or 10 kg or 5 kg. But the thing is, on the first 1 week, they will do regular workouts. But after 1 week, if you don't focusing about the movement, means obviously there will be a chance of injury or there will be a chance of pain. So that make, again, they will for sure they will stop the exercise, they will stop the workout. That's the one reason.
Any questions, anyone? Can use the chat or unmute and ask.
Yeah, Sean. Yeah, definitely. Yes, I think I know you better, but definitely right. Something which very pretty common in IT professionals is like hardly very less physical movement, right? Especially for me, I have seen people having issues with their elbow. I mean, hand. No, when they difficult to move their hand, especially palms and all. And the other common issues, especially with the lower back pain, which I think I already had. I think I got it fixed with your help. And definitely, right, that is something which I think you should also cover. I mean, like, can you just give that or speak about that as well?
Actually, for the IT professionals like you or any city professionals, actually, the main conditions that we are getting is neck pain, tennis elbow. Tennis elbow is one of the major thing. But as a movement specialist, I cannot say it is a tennis elbow. It's just a movement issues. Okay, we'll assess your shoulder movement. We'll assess your scapular movement, scapular strength. Because sometimes, some patients are wonder. Actually, in my clinic, I have lot of patients with coming with tennis elbow. So one of around 45 years female came with tennis elbow to my clinic. At that time, I just assessed the shoulder. Then she's surprised actually. Why you are assessing my shoulder instead of my elbow? I have pain on the elbow. Why should you assess the shoulder? Because I have to assess before and after, below and after the injured area. So same concept for any issues, for a neck pain, for a back pain, for any injury. If it is red flag, as like Sarah said, there are lot of red flags in physiotherapy also. So if it is red flag, means we will definitely refer to physicians, referred physicians. Red flags, that means like a spinal tumor, ankylosing spondylitis, like that case.
Thanks, Sean.
Yeah.
I think there is some question from Neha. What kind of pain when it is caused by doing wrong yoga or wrong workout?
It's like radiating pain sometimes. If you're not treating the muscular imbalance, means sometimes it is radiating. We also wondered at that time, because sometimes we'll say that I do exercise regularly, I do yoga, I do workouts regularly, but why I got radiating pain? Why I got sciatica? Like that, someone is wondering. So the same thing. If you are doing a yoga or if you are doing a regular workouts, most of them are for large group of muscles. There are some small isolated muscles are there in our body. So no one is aware about the small muscle groups. There are a lot of small muscle groups to be more activate.
Thank you.
Yeah.
Yeah, hi, Sean. Usually, sometimes you will be getting neck pain, but it will not go rid of so easily, and it will take few days together. Usually, whom we need to contact, we can go directly to physiotherapy or any specialist.
Actually, if anyone is expert in, if you go to physiotherapy, it's okay. But if you go to physiotherapy, there are two types of physiotherapists there. Conventional physiotherapist and exercise-based physiotherapist. If you are doing a conventional treatment, actually, you will get pain relief, but it's just a temporary. But if you want to do a permanent solution, get a permanent solution, you should go to any movement expert or in experience in physiotherapy.
Sean, how will people understand if they are a movement expert? I mean, in your case, you have clearly called it out. Will all the movement physiotherapists call it out?
The thing is, there are in Kerala, there are 10 movement physiotherapists there in Kerala. And in Bangalore, is one of, actually my boss is in working in Bangalore. His name is Dr. Patnaba Shekaran. He's my lecturer actually.
Oh.
He's one of the leading physiotherapists in India. And if you need any help regarding the movement expert, you can directly contact me. No worries, I can easily help you because I have to break the concept. That's the main thing.
Okay.
Any other questions, anyone? Awesome. So great. Thanks a lot, Sean. It was nice interacting. I think many questions will come. People are going to think about it. That's one of the good things.
Yeah, always welcome. Always shoot me. Even after the sessions, also shoot me.
Hi, Joe.
Yeah,
I'm Rini
go
here.
ahead.
I have a query.
Sure, go ahead.
Sean, I work in railways, and my work culture is like I have 2 night shifts in a week,
Okay.
and I'm a victim of this prolonged sitting. Like
Okay.
for the past few weeks, I have been having the back pain, the lower back pain, and there is inflammation in the back, lower back, and I'm not able to recover from the pain yet. Like it's been a while now, for a week nearly. Like there is no option that I can choose out from this job profile. So I'll have to sit nearly for 12 hours in the night.
Yeah. The thing is, there is no actually there will be option. You have to fix the back. That's the
Yeah,
only
okay.
option. There is no other
Okay.
option. There is no random alternate option for that. There is no need of quitting the job. There is no
Yeah.
need of making some ergonomic chair or nothing. You have to fix the
Okay.
back. That's all.
So like, how do I do? I just got a back support cushion. Like,
Yeah.
what else can be done? Like,
Yeah, actually, before that, we have to do some movement test actually. So whether
Okay.
it is for where the pain comes from, whether it is from
Okay.
moving forward or moving backward or moving
Okay.
sideways. So I have to
Okay.
rule out first thing that then only we can do. There will be some muscles will be tightness. There will be some
Okay.
muscles are weak.
Okay.
For example, I already said the one example. No, for example, for lifting the hand. No,
Yeah.
for preventing excessive movement. For
Yeah.
preventing excessive movement, there will be some muscle groups. So that is
Yeah.
called
Yeah.
stabilizers.
Okay.
Okay. And for moving the shoulder joint easily, no, there will be some movement muscle groups. That is called mobilizers. So
Okay.
we should work on these two group of muscles, mobilizers and stabilizers. So mobilizers is mainly to lengthen the muscles, and stabilizers is mainly for activating the muscles.
Okay. Okay. Right.
So Sean, Rini is in Bangalore. So does your boss take consultations?
Sure.
Yeah. So Rini,
Okay.
I'll from Hashim, I'll get you the number and you can contact him. And see, many
Sure.
of these things requires a physical checkup actually, right? I mean, they have
Yeah,
to do a lot of
exactly.
experiments
Yeah,
and
exactly.
find out.
No one is concerned about the physical health checkup. No, when you're inside the body, we can do the blood test, sugar,
Exactly.
cholesterol, everything. Yeah, but no one is about the physical checkup. But sometimes, no, if you are not concerned about the physical check, sometimes you are to. It leads to diabetic,
Okay.
blood pressure, cholesterol, everything.
There's a question by Mahnur
Thank you.
Arif. Actually, my mother can't fold her knee. It's happened after Corona. It is very difficult for her to bend her knee and it's painful.
Yeah.
After Corona.
Yeah, actually, after Corona means it's a somewhat maybe due to some medical condition. So first of all, we have to rule out whether it is any medical illness is there or not. So we have to rule out with the obviously we have to type with the doctors whether it is any blood they have to do some blood test or anything. Then only we have to rule out because
No, actually, my mother, she don't have any medical condition.
fine. Okay.
But few months ago, we went to a doctor for her checkup because she was having a back pain. Like you can say near to the hip, last you can say in her backbone, and after that she's having very bad leg pain and knee pain.
Is she
So
doing bed rest
the
at the time,
doctor,
COVID time, bed rest?
yeah, she was on bed rest, but it was not proper. Actually,
Okay.
when we got to know that she's having a corona, and after that we took some precautions. Before we were not aware of that. We just
Yeah.
thought that it's a simple fever or something, like she's like weather uh, sick, and I don't know. After that, doctor, he said that she is having infection in her kidney,
Okay.
like that infection in her urine, and just because of those kidney, those that infection affects her knee. So
Okay.
I think so that it's a different thing, maybe because before corona she was very well.
Yeah, understood. So the thing is, for sure there will be some movement impairment before corona also. But the thing is, after corona there will be a generalized weakness, general deconditioning. So both come together, both generalized weakness and although also there is a history of movement impairment. For sure, even me also there will be a movement impairment. So I also have to correct it. Okay, the thing is,
Okay.
how we know means after any injury or after like this type of condition, then only we'll definitely diagnose it. We'll do the checkup. Otherwise, we'll never go for a movement checkup, right? Till now, we'll never go for any. We don't have time for going for a blood test or a sugar, everything. Correct? No.
Thank you so
Manur,
much.
if you are in
Yeah.
Bangalore, again, let me know. I can get the number of Sean's lecturer and pass it on.
Yeah, sure.
No, sorry. Actually, I am in Saudi Arabia and I'm from Pakistan.
Okay, not an issue.
But we can do the online. They can do the online consultations or the sessions. They can provide.
Okay,
Okay.
fine.
Or we can give my number also. No problem.
Who is your coach, Mahanur?
Actually,
Rakesh.
Rakesh Ravi.
Sure.
Yeah.
I'll pass on the number to Rakesh.
Actually, it is a long topic. That's why actually I take it as in a very basic things. I know a lot of confusions
Yes,
and a
it
lot of
is.
things there. Yeah, but the thing is, if I teach that type of things, we cannot catch it easily. It's a even at the time of my
Yeah.
course also, I am sleeping at that time. To be frank, it's a very difficult topic actually.
Yeah, someone
it
else
is.
also has asked for
Thank
the
you so
number.
much.
Yes, Lina, I'll pass on the number to you. Okay, so that's great, guys. Two wonderful topics, two wonderful speakers. We've learned a lot. One thing I'll keep repeating, I do tell this again and again. At least once a year, please do get your full body checkup done. At least once a year, right? And now let us add the movement checkup also, right? That is one more thing that we can add to that checkup. Well, let's make sure that if you have any pains, let's do a movement checkup also. I'm going to go and meet Sean. Let's do a checkup and find out. I'll share my experience also.
Always welcome. Always welcome.
Yeah.
My testimony. I have my personal testimony, Joe. I think I did my test under Sean only, so he helped me a lot. I think I was having lower back pain, and I was suffering like anything. So I think definitely right. That was one of the reasons why I wanted Sean to speak in this forum. Definitely, I am sure that it is going to benefit many and the team. Thank you, Sean.
Awesome. Thanks, everyone. So please do a couple of things. One, please go ahead and invite more and more people to attend these sessions. Right? You can put it up on Facebook, anywhere you want to, not a problem. Second, if you are someone like Sean, like Sarah, who knows something that most people don't, right? Please be open enough to share it. It's so important to share knowledge with others. So very important. Can make this place a better community if we can keep on sharing information. If you know someone who is happy to share information, we would love to get to hear from them as well. So thank you, everyone. Have a great night.